Hi, I'm Dr. Doug Gulbranson. As we think about cash flow and profitability, there's one area that oftentimes we don't necessarily overlook from the standpoint of importance, but don't recognize the amount of money that we might be losing because of some of the ways in which we handle things. Prime example of that is employees. National studies have shown that a bad hire can cost you right around at a minimum 5 times the annual salary. So for a doctor and the salaries that they normally pay their assistants, that could potentially be over $100,000. Well, think what $100,000 would mean to you as additional profitability. So the question is, what is it that causes us to make bad hires? Or what is it that causes us to maybe make a good hire, but they don't stay with us for very long because of some type of dissatisfaction? You know, it's interesting, as we diagnose patients, one of the first things we do with a new patient is to get radiographs. And for a physician, if someone comes in and they're having some struggles, one of the first things they do is do some blood work. Well, why do they do that? Because there are certain things that you can pick up in radiographs, there are certain things you can pick up with blood work that is not obvious to the doctor's eye. Well, how does that apply to hiring an employee? Bottom line is that when people come in to apply for a job, particularly within the dental office, number one, because of the economy, everyone is looking for a better paying job. And number two, when they come in, we tend to have a very specific protocol, but most of the time, we're in a hurry to hire, because we've just lost our assistant, we've just lost our receptionist, whatever that happens to be. We don't have time to really plan on that hiring protocol to take place. And so what happens is we hire someone based on that interview, and then we find out either, yeah, they were a great hire, or in fact, they were not a good hire. So how can we apply diagnostic principles to hiring an employee? Well, the best way that I know is the use of pre-employment evaluations. And those are specifically able to go in and analyze different parts of an individual that you're not going to see in a regular interview. For example, what happens if you hire someone that just is an incredible individual, comes across very well, you put them in a specific position, and all of a sudden, 2 to 3 months down the road, they're not happy, they're not satisfied, they're not feeling fulfilled? Well, you could have prevented that had you been able to do a specific type of personality profile on that individual before you hired them, to make sure that their personality was going to be fulfilled based on the job description that you were hiring them to accomplish. There's one other type of test that's really important, and that measures a variety of significant things for you as a dentist that you would want in an employee. The first thing is honesty. How important is honesty to you? Well, for those of you that have experienced losing a little bit of money because of embezzlement, you understand how important that really is. Secondarily, responsibility. How many times have we hired someone and found that for the most part they're a lazy Susan, just going round and round and round, but not really being responsible for their specific job? Or how many times have we hired someone that after we've hired them tends to be a bit critical of our practice, critical of everyone else, and they're not afraid to voice it? A lot of these things we can pick up: responsibility level, criticalness level, honesty factor. Are they overwhelmed in their life and so they're going to bring their home life to work with us? Those are some of the things that we can also diagnose and pick up in pre-employment evaluations. So I would really encourage you to consider doing some pre-employment evaluations prior to hiring an individual. Now, they're not that expensive. They're not inexpensive, but they're not that expensive. And so it's important to make sure that as you're going through the hiring process, that you narrow it down through your interview process and protocol to about 2, maybe 3 candidates. And then at that point in time, that's the time to do the pre-hiring assessments. And once you've done those, you combine those with everything else that you've gathered, including checking their references and maybe even doing a background check on them. And once you've combined all of that together, you are going to have an 85 to 90% positive experience based on testimonials that I have, that you will hire the right person for the job. If you have any questions, feel free to contact me. I'd be happy to talk to you about your particular situation and frustrations relative to hiring the right person. Thank you.